All right, today we're going to dive into something that's, surprisingly simple but absolutely vital in kidney care. It's a little rule that makes sure a patient's lifeline is good to go. It's called the rule of sixes. Okay, so picture this. If you have kidney failure looking at being connected to a dialysis machine, week in, week out, it's a reality for so many. So the big question is, how do doctors make sure that that connection point, that literal lifeline, is strong enough, safe enough, and just ready? Well, the answer is actually pretty amazing. It's a really clever surgical fix. See, instead of just using a regular old vein, they basically create a super vein. The official name for it is an arteriovenous fistula, or AVF for short, and honestly, the name kind of gives it away, right? Arterio means artery, that's the high-pressure pipeline from your heart. Venous means vein, that's the low-pressure return trip, and fistula, that's just a fancy word for a connection. So what surgeons do is they connect an artery directly to a vein, usually somewhere in your arm. Now, what this does is it forces all that high-pressure blood from the artery straight into the low-pressure vein. This whole process is called venous arterialization, and it totally transforms that vein. The best way to think about it, it's like taking a quiet little country road and upgrading it into a massive multi-lane superhighway. It's built to handle a huge surge in traffic, in this case, blood flow. But just like you can't open a new highway the day after you pour the concrete, this super vein isn't ready for prime time right away. It needs time, it has to get stronger, wider, it needs to mature. So the question becomes, how on earth do you know when it's ready? And that's where this really clear, simple, clinical checklist comes into play. It's a guideline that just takes all the guesswork right out of it. And really, the key to this whole thing, it all boils down to this one single number. Yep, this is the heart of what's called the rule of sixes. It's a super simple memory aid that helps doctors and nurses figure out if that fistula is ready for dialysis. So here's the whole shebang, the full rule of sixes. First, time. The fistula needs at least 6 weeks to mature after surgery. Second, flow. The blood has to be moving at a rate of at least 600 milliliters per minute. Third, diameter. The veins gotta be at least 6 millimeters wide. And fourth, depth. It can't be more than 6 millimeters below the skin. Some folks even add a fifth six to the list, making sure there's at least 6 centimeters of straight vessel to work with for the needles. Okay, let's actually dig into these sixes one by one because it's really important to understand why each one matters so much. All right, first up is time. We're talking a minimum of 6 weeks after the operation. And this isn't just some random waiting period. This gives the surgical site time to actually heal. Plus, it gives the vein time to get used to this new high-pressure situation, letting it thicken up its walls and get bigger. Okay, next on the list is flow rate. The goal here is a pretty powerful flow. We're looking for at least 600 milliliters per minute. So you're probably thinking, why that number, why so specific, and why so high? Well, the whole point of dialysis is to clean the blood, right? And for the machine to do its job well, it needs a lot of blood coming through at a steady, fast pace. Hitting that 600 ml per minute mark means the treatment is going to be efficient and, most importantly, effective. Moving on, we've got diameter. That vein has to get wider, at least 6 millimeters wide. So again, what's the big deal about this specific width? It's actually super important for 2 big reasons. First, a wider vein can handle all that high-pressure, high-volume blood without getting damaged. And second, it just gives the clinicians a bigger, easier target to hit with the needle. And that's absolutely crucial for getting a successful treatment, every single time. And last but not least, we have depth. Now, pay attention here, because this one's a little different. It's less than or equal to 6 millimeters deep. So why is being close to the surface just as important as being wide and having a fast flow? It all comes down to being able to access it safely over and over again. Think about it. If the fistula is buried too deep, it's really hard to feel, and it's even harder to stick with a needle accurately. Keeping it at 6 millimeters or less from the surface means clinicians can get to that lifeline safely and reliably for every single treatment. So when you put it all together, the rule of sixes is way more than just a clever little memory trick. It's a seriously powerful, life-saving guideline. Each one of those sixes lines up perfectly with what you need for successful dialysis. You've got high flow for efficiency, a wide diameter for strength and easy access, and a shallow depth for safety and consistency.
Every single measurement is tied directly to the patient's health and well-being.
It's the simplicity of it that's so brilliant. By following these super clear, measurable goals, medical teams can be sure that a patient's fistula is going to be a true, dependable lifeline. A simple rule for a procedure that saves lives. How cool is that?